Namaskar, Sat Sri Akal, Salam Alaikum. How are you all? Once again, we are here on this IAT talk with a medical expert. This is our third session. I really appreciate all the volunteers, those who are working for the COVID cause. We have various communities, they are working on it. And I'm really thrilled and see the way everybody is really working day and night. We have our IIT, one of the gym, I call him youth chairperson, Mr. Nikon Sachdev on screen. Nikon,
Sat Sri
welcome. Sat Sri Akal, how are
Akal.
you?
Namaste. How are you, Uncle? How are you, Mr. Chuan?
I'm
Very fine,
good.
thank you.
I'm perfectly all
Sorry, today
right.
I'm not at home. I'm not at home, but as per instructed by Uncle Chuan, I'm here live on Facebook with you. Thank you so much, Uncle Chuan, for
Y-
taking a minute to thank all the volunteers who are helping us in our COVID fight. So we have actually called them the Thai Indian COVID heroes. Now, we've set up a group, and this group has been helping all the infected people who need help from us in our Indian community in Thailand. They have been working very hard, sometimes late into the night, and some cases where even at 2 a.m. or 3 a.m., they are taking care of people
All right, Nikon, let me welcome Renu also on the screen. I think your net is going a little bit. Okay, let's welcome Renu on the screen too. We have one more volunteer here. Renu ji, namaskar.
नमस्ते
कैसे हैं?
स्वालिहा हम ठीक हैं आप कैसे हैं
मैं बिल्कुल ठीक हूँ. Yes, good to see you all in this pandemic time where we hardly meet each other, but we are working together. We are connected through WhatsApp, Line, this social media, but we are reaching to almost everyone, whoever needs help. Today, it was a wonderful day this morning that we have IAT did our vaccination drive. That was second dose. Can you update Renu on that one?
yes we had whoever registered with us they all turned up at the hospital and they did get the second dose they were very appreciative of IIT efforts and we wish them good luck and we are trying for our second round so we will let you know and today we have exciting a young doctor. So, Papniji, you can introduce her, please.
Ji, I wanted to give a credit to our president, Mr. Sarabjit Singh Sachdev, who told me that okay, let's have a different doctors every week. So last time we two episode we discussed on COVID on general. Then
yes.
Dr. Kanchana and Dr. Harry was there.
Mhm.
Nikon, can you talk about backdated this whatever we have done? Just update, recap.
All right. So we have had Dr. Nan and Dr. Harry, and also besides coming on the show and giving the information on, Dr. Nan came and gave a very good information on how to do basic home isolation in this COVID times and what basic medication to take. And Dr. Harry came and Dr. Harry told us how to actually keep fit during the COVID times and what to do at home to keep a sane mind during this pandemic. So actually, Uncle Poppy and Pan Venu, let me update you. Even though Dr. Harry and Dr. Nan came on the show, we are still troubling them every single day, actually several times a day. Many of our people, right, of our Indian community who are infected, they are sitting at home because due to the lack of hospital beds, but they need a teleconference call with the doctor. So that's what we are facilitating, and we're getting them directly in touch with the doctor and letting them ask their questions and letting the doctor make a first judgment on the phone as to what medications to continue with.
We've been doing the medication giving to the various people, whoever needed, right? Initial. Renu, I think you prepared all the packets, right? So can you talk on
Yes.
that with medication also?
So, as per the advice given by both the doctors, we have prepared home isolation kits because, especially people who do not have big families, they are unable to go out to get the home isolation kits. So, as soon as we receive a call, we have reached out to Samut Prakan, Bangna, Putna Monthon, and even till Ayutthaya as well. So these are the kits that help people who are at home. They can monitor. We have cough medicine. We have a digital thermometer. So all the medicines in the kit are as per what the doctors have advised us, and it's been helpful. And yes, so if you need help, let us know.
So I like to say thank you to all the volunteers, not from IAT, from various, and especially our IAT directors. It's not that they are sitting backside. We three are coming on a screen, but actually they are working behind this one. They are setting up all the programs. They are giving us the guidelines. And I like to say thank you to our president, who's constantly in touch with us. Our
Thank you,
uh,
Uncle.
Papinder also, he's constantly in touch. We have various directors, those who are checking with us. Okay, anything is problem there, they are always backing us. So thank you to them. Not wasting further time. So let's come to the show. Our show is IIT Talk with a medical expert. So let's welcome medical expert Dr. Niti Shri Kukreja on screen. Namaste ji.
Namaste ji, Sat Sri
Welcome.
Akal ji, Sawadee ka.
You
Hi
got a beautiful
everybody.
smile. Wonderful
Dr.
smile.
Niti.
Yes, I
Thank
really like
you.
it. Okay,
Thank you
Renu
so
ji.
much for inviting me here.
Ji. Ji, Renu ji,
Oh,
can you talk to Dr. Niti and can you
Doctor, I'm
introduce?
welcome to IIT. Doctor, welcome to IIT. Sorry, today I'll be leaving you in the hands of Mr. Chuan and Pan Renu. I'm sitting in the car right now and it's very bumpy, but I'll catch your show on Facebook Live. See you.
Okay,
See you,
enjoy.
everyone.
Okay, no
Yeah,
worries.
enjoy.
Bye bye.
All right.
okay. Dr. Niti, thank you first of all for joining our show. We are very excited. And as Papniji did mention that we had our previous two sessions where Dr. Nan and Dr. Harry also had kindly shared their information on home isolation. And Dr. Harry said about those exercise at home. But now we have another segment. We had a request for new moms to be and who have just delivered. We do understand their concerns during this pandemic, and hence we reached out to you. And once again, thank you for joining. And we're going to have some questions, but first of all, if you could just quickly introduce yourself, tell us about yourself and your role at the current stage right now.
Okay, so hi everybody. My name is Niti Sikurecha. I'm a medical doctor and I'm an obstetrician and gynecologist. I currently work at the Mission Hospital in Bangkok. Thank you so much for doing this IAT. I think it's really nice that you're getting everybody together and reaching out to the community and trying to create a sense of well-being and just a sense of community, because we're all so separated at this time. So it's very nice that you're doing this, and thank you for inviting me on here.
Ji, welcome. We are really touched that you came in and in a very short span of time. When we asked you, I said, okay, I know you're super busy today. You took out some time, and we are with the total community. We are here, and now we have few questions. Renu and me gonna ask you a few questions on behalf of community. Ji, Renu ji.
Okay. Dr. Niti, as the first question that we have is if any lady is expecting a baby, so what about the usual checkups, that she needs to go to the hospital? So is it any risk,
Okay.
visiting hospital? Uh-huh.
Okay, so this is a really good question, because obviously I think at this time a lot of people are afraid to leave their homes, and we shouldn't be going out unnecessarily anyway. But when you're pregnant, obviously you will have frequent checkups every month, or more frequently as you head into the third trimester, and even perhaps weekly when you're at term. So if you are very early and your pregnancy is low risk, speak to your doctor. Sometimes they may extend the interval between each checkup a little bit more, maybe from 4 weeks to 5 or 6 weeks, depending on your status. But always speak to your doctor first. In the early pregnancies, you can do that often, sometimes, because obviously we're trying to limit the number of times you have to visit the hospital, trying to limit the number of people at the hospital. However, you have to speak to your doctor in case there is a, if because they will be the only ones who will know your pregnancy. So if you're low risk and you're very early, you can increase the interval. However, later on, especially in the 3rd trimester, I would recommend you go to all your appointments, and and they will be more frequent. But so I think in the same way, because obviously we have to go out sometimes for our checkups and stuff. So just take the adequate precaution, wear a mask, wear a face shield if you have to, and try and limit contact with other people as much as possible during these checkups.
Good.
Okay, so we have the next question is, if I have COVID while one is pregnant, will I pass it on to my baby? Yeah.
Okay, so having COVID during pregnancy, there is especially close to during delivery, so there's very low chances of passing it on to your baby. So these are very preliminary studies, but they've shown that the risk of mother-to-child transmission of COVID is quite low. It's unlikely. Often it might be after the baby is born, when when you're handling the baby, that might be the time when you're at higher risk of passing it on. So, and also children are, as we all know, children do much better with COVID than adults and the elderly. So many times, baby might have very mild symptoms or even be asymptomatic.
Okay. So if a person gets COVID while pregnancy, right, are the symptoms are more severe for pregnant ladies?
Yeah, so this is a very good question. So pregnant people are just equally at risk of catching COVID, but once they catch it, pregnant women, due to various reasons, due to the fact that they're carrying a baby and the difference in their immune system and various other reasons, they are at risk of having more severe symptoms compared to non-pregnant ladies, right? They're at increased risk of having respiratory distress, pneumonia, requiring a ventilator, and also increased risk of being admitted to the ICU. Now, for pregnant women who catch COVID compared to pregnant women who don't have COVID, those with COVID are more likely to deliver prematurely, which means having a preterm delivery before 37 weeks. They have an increased risk of having neonatal complications, being admitted to the ICU, and also increased risk of having a baby with low birth weight.
Okay. So now with lockdown, for example, and this curfew, for example, what if during that time the water breaks, right? Unexpectedly, it has happened. So what would you recommend? How long normally can one wait at home?
Okay, so this is a very good question, and this is something that we always have to advise our patients. COVID or no COVID, the rules are the same for this, and curfew or no curfew, you have to come if you medically you have to, right? So symptoms that you're in labor are water breaking. If your water breaks, please do come to the hospital immediately, because you will need a pelvic exam. Other symptoms that require you to come to the hospital are having labor pains. Now, these labor pains, sometimes there are these they may be irregular contractions. If you feel like you're having irregular contractions and they come, say, every half an hour, 1 hour, 2 hours, you sit down, you rest, and they go away, that's okay. That's probably just, it's called Braxton Hicks contractions. It's in Thai, you say, "Jep kan tuan." So it means that, you're about to go into labor, right? But if you feel that your contractions are more regular, they're every 10 minutes, you sit down, you rest, and you're still having contractions and they're painful, then you should come to the hospital. Other symptoms that require you to come to the hospital are if you have any bleeding or if you feel a decrease in fetal movement. So any of those symptoms, please do come to the hospital. Curfew or no curfew, I'm sure the checkpoints and the police, they will let you through, because you have to.
Right. And one question which many people were curious is that the pregnant ladies, right? They
Yes.
can get vaccines, correct? COVID vaccines, they can get, right?
Yes, yes. So the thing is that the vaccines that are available in Thailand, there's the Sinovac, Sinopharm, and AstraZeneca, and these have
Right.
not been tested on pregnant women per se, because pregnant women have not been included in these trials. But the method of vaccines, these use inactive vaccines. They've been used many times before, and those vaccines have been shown to be safe in pregnant women. So according to the Thai guidelines and the WHO, what they recommend is to assess your risk and benefit. If you feel like you're at high risk of getting COVID, and if you feel like you're at high risk of having severe symptoms from COVID, then you should definitely consider getting vaccinated. So recently, the Thai government, they released new guidelines that, suggesting or encouraging most pregnant women to get vaccinated. And in fact, they have priority in this because with the surge in cases recently, there's been shown that more pregnant women are having severe symptoms. So they've been recommending it usually after 12 weeks. So after 12 weeks, you can contact the government at Bang Su or at the other Ma Prom or all the other registrations, and they will give you a priority vaccination.
Yeah, that's what it was very nice, and we saw at many places that the government is giving, the special lanes for pregnant ladies, which is very good. Now, one important question is, what about after delivery? Okay, first of all, would be a normal or a C-section, and after delivery, if I may just continue, breastfeeding. Do you recommend it, the normal breastfeeding for
Okay, so in terms of delivery, cesarean or vaginal delivery, so this will depend on various things. Being COVID positive alone is not an indication for a cesarean delivery, unless you have severe COVID or severe pneumonia where it would be helpful for you to deliver with a cesarean, in terms of for your own treatment. But if you have very mild symptoms of COVID or you're asymptomatic, then you don't necessarily have to have a cesarean delivery, but you have to look at it case by case, because sometimes a woman may have other indications for getting a cesarean. For example, if the baby is not in the correct position, or if the placenta is located very low, placenta previa, or any other indication where they might need a cesarean. So it's important to examine each woman individually and assess the risk and benefit for each type of delivery. But if you have no other indication and you're asymptomatic or have very mild symptoms, then you don't necessarily have to have a cesarean delivery.
And breastfeeding, what are your...
Oh, yes. So breastfeeding, you should definitely continue to breastfeed. Breastfeeding, exclusive breast milk for the baby in the first 6 months has multiple benefits. COVID or no COVID, it reduces the baby's risk of infection, ear infection, respiratory infection. It increases the bonding between the mother and the baby. So for a baby in the first 3 to 6 months of life, they don't respond very well to infections. So they don't build as strong an immune response to any bacteria or viral infection. So the mother's breast milk actually contains multiple antibodies that she has built over the years that can be used to support and prevent the baby from acquiring different kinds of infections. And it's the same with COVID. So for COVID as well, you should definitely continue to breastfeed. But there are certain things that you should be aware of. So if you have severe symptoms, you may consider expressing the breast milk, maybe using a pump, and asking somebody else without symptoms or without COVID to feed the baby for you, but keep continuing to express milk so that you have, once your symptoms go away, then you can breastfeed the baby yourself. Or if you have very mild symptoms, you can feed the baby yourself as well. But just make sure that you're wearing a mask, and you every time before you handle the baby, you wash your hands with soap and alcohol, and make sure you're not spreading make sure you're not spreading any germs to the baby.
Right. So just a bit more careful than the normal. Yeah. Okay.
I think overall you covered a lot. Yes, but I just wanted to ask you, when the women's or new mothers, when they come to the hospital, generally what question they ask you, because I don't see anybody has asked further more questions. So I'm asking you, because you must be knowing this one where regularly what new mothers they ask you.
I think Auntie Renu has covered a lot of the questions,
Uh-huh.
probably from experience, and so those are mostly the questions. Can I come to my appointment? Do I have to move my appointment? What about the
Mhm.
vaccines? Can I breastfeed my child? Those are the main questions that we often get asked.
Okay, those who are family planning, right? Those who wanted to be mother during this time, what is your opinion? They should wait or no problem, continue and have babies?
I think it's a good idea to wait. I definitely think you should wait until the peak of the pandemic is over. But if you do get pregnant, then please come for your antenatal. But if you can avoid or delay your pregnancy for a few months, then definitely please delay it.
All right, good. Renuji, you have any other questions?
Not yet, but definitely. I mean, in terms how, if you can share from your experience for moms, to take care before and after something, especially during this time. Um, any helpful tips from them in terms of if anybody has like anxiety, they're scared. What is how to handle, because I'm sure, right, in normal cases already they are very anxiety, especially when they are on the ninth month, right?
Yes.
So with the current pandemic, any guidance, any tips from you?
So that's a very good question. I think with the pandemic, everybody is panicking and everyone's scared. So, and I've shared some statistics which don't sound very good, but I think just bear in mind that we have to be aware so we can be informed, not so that we can panic. So the more aware we are, the less panicky we can be, because we are aware of the risk. So as long as you are, staying home, limiting your contact with the outside, and then there is really then you're at very low risk of getting COVID. So just bear that in mind, and try and do things that make you feel happy, and try and meditate, or do exercises. Even when you're pregnant, you can exercise. Maybe do some light yoga, continue to walk, and try and go outside. Like if you have a balcony, or if you have a garden in your house, just try and spend some time outdoors with fresh air, and just connect with the people in your COVID bubble. So in your family, spend time with them, and those things. I feel like those basic things, they really help someone feel grounded and feel at ease, and it reduces being afraid. And also, I think another thing is having numbers at hand, any emergency contacts in case you need to consult with somebody, or having all these numbers available, being able to access any medical care. Just knowing that you have access to immediate medical care in itself is already something that I feel comforts a lot of people.
Mhm.
Right.
Any
I mean,
dietary suggestion for the new mothers or this thing during COVID? What
in line with the COVID.
So
food and intake and this thing?
Hanji, so just continue eating. I think just try and eat healthy, lots of fruit, lots of vegetables, drink lots of water. So those would not be different from non-COVID, from non-pregnant patients. Just try and eat food that will enhance your immune system, right? So lots of fruit and vegetables.
During this time, everybody is asking, okay, in COVID, can we do this one? Cannot do this one? Can we do do's and don'ts? So they are just throwing the question on us. I said, so similarly, I'm asking you. I said, okay, since the we are in, people are watching us, so it's better you tell them, no?
What kind
Doctors
of,
should,
as in do what?
general
Sorry.
question they ask, no? एक कोविड हो गया, ये कर सकते हैं, वो कर सकते हैं, ये खा सकते हैं, वो खा सकते हैं, तो these are the simple questions. Sometimes it's a just general knowledge. So when a doctor speaks, so they take it as a granted. Okay, when we speak, they all ask another person.
As in like what foods to eat, or
Yeah, food and intakes and this thing. Yeah.
okay, so I think it generally we should be eating healthy all the time anyway, not just during
Yeah.
COVID, So health is built like long term. So you should be trying to eat, intake eating a lot of whole foods, a lot of fruit and vegetables in your diet, limiting processed foods. Those are the things that you should be doing all the time anyway. But especially now that we've seen like people who are healthy are having a better reaction to COVID, and people who are unhealthy are having more severe symptoms. So people who have diabetes, have kidney disease, have obesity, they're the ones who are having more complications. So just bearing that in mind, we should all try and live an active lifestyle and try and eat healthy foods so that we can improve our immune system, not just for COVID, but for any virus or any bacteria or any infection that, may pop up in the next pandemic or, so I think it's very important to go back to our basic health status and just keep our immune system strong. So if you're at home now, there are so many things that you can do. This is a perfect time for you don't have to commute to work. You have extra 2 hours on your hands. You should definitely take this time to exercise. And I know there are so many exercise groups. I believe IAT also has an exercise program. Is that correct? A joint dance group for the ladies or something. So definitely, join any form of exercise group, aerobics or yoga or anything, just to keep yourself fit and active, and just try and eat healthy foods. Like order less and just cook more, perhaps. Cook and just eat less processed foods.
Any vitamins to be taken during?
Oh. Yes. Okay. So it's been shown that vitamin D deficiency is linked to more severe COVID. So definitely, and studies have shown that you should consume vitamin D3, vitamin C, and also zinc, as these help with enhancing your immune system. So, I have the doses, but I could send it to you and maybe you can post it in the group, some more information and resources that you can post and share later on. So these things I would suggest.
Okay. So now...
And also in terms of, I think for the moms, maybe they can work on the list of before, when they're on the 8th month or the 9th month, work on the complete list of what are the things going to be required after delivery, because nowadays, due to, the lockdowns, it's not easy and recommended to go out and do a lot of buying, right? So that also should be something helpful. Have your list ready and stock up whatever for the baby is required and for moms. So this is something about babies and moms. So what about fathers? Anything for them, like to I'm sure they are also in panic and anxiety, and they also have. So have you had any father coming up to you and asking questions in terms of how to take care, do's and don'ts? Let's hear about that too from you.
Okay, so recently I had one father say that every time the mother is upset or feels, like he feels overwhelmed, like he doesn't, he wants to help but doesn't know what to do. So I think the best thing is just to ask. Like if you're a father of, if your wife is expecting a child, then just ask her, what would you like me to do? Because every woman has different needs, they require different things. So ask her how can you help her, because she's the one carrying the child, and obviously it's a family, it's both your child, but I think it's very important at this point, especially for the man, to be supportive for the pregnant women and try and help her in whichever way he can.
Okay, good. So Dr. Niti, for moms who have just learned about the pregnancy, especially we have in our Thai Indian community, we have, expatriates. Sometimes they want, English speaking. So you are currently at Mission Hospital, correct?
Yes.
So, okay. So this is a message for, people who are watching and listening. Niti, you speak Thai, Hindi, you understand a bit Punjabi, correct? English. So anybody who wants to consult can reach Dr. Niti at Mission Hospital. And we really thank you once again for your time and for your message and sharing your experience. Papi ji, any more questions? Voice.
Yeah. You covered everything has been whatever questions we prepared, and some questions were on a screen, so I just asked doctor. They were talking about this thing, and it was a wonderful session. And I really appreciate that doctor came here, and just wanted to tell public that okay, you are in Mission Hospital. Viewers are watching, so at least they can talk to you. Maybe they have some question one to one. They will be in touch. And if not, then Renuji is always there and upfront to connect you people whenever any mothers they have some questions. So I like to say thank you very much that coming on show. I really appreciate on behalf of IAT. Thank you very much.
Thank you very
Renu-
much, Uncle Papni and Auntie Renu, for inviting me, and I hope it was helpful.
Yes,
Definitely.
it was
Yes.
always helpful. Whatever. Okay, there's a see somebody has sent a message. Excellent session with Dr. Niti. There's a message too. So thank you.
Thank
All
you.
right. Okay. So
Do we have extra time, maybe, for people who are thinking of this line, maybe I know this is COVID, so if I could just shift to forget like COVID for some time, for the new graduates who want to kind of get into your line, and any advice, any tips for them?
Into my line, as into medicine or into. Sorry?
As a gyna, if they want to get
Okay.
into specialize into gynecologist. Mhm.
So any advice? So firstly is once you choose a specialty, you choose once, and then you do that for the rest of your career. So just be sure about what you want. If you need to take some time to explore a little bit more, explore with different specialties, you should definitely do that. And for me, I chose gynecology because I love working with women, and I love having both doing both medicine and surgery, and having a mixture of everything. And so that's why I chose gynecology. So I think it's important to see why you want to do it, and if you do, then there's nothing stopping you, because you can definitely if you set your intention to something, you can definitely achieve it. So anybody in the community who wants to pursue medicine or gynecology, I'm very, very happy. I would love to speak to you and help you in any way that I can.
That's very kind.
Okay.
Thank you very much for that.
Okay. Thank you very much. जी रेनू जी, it was a wonderful session with the Dr. Niti. अभी जो हम कर रहे हैं कोविड के लिए, दूसरों के लिए भी, जो मेडिसिन के लिए हेल्पलाइन जो हमारी है, उसके बारे में थोड़ा आप आगे बताएंगे?
जैसे निकॉन ने मेंशन किया था कि there are few people in the community which is they're working very closely, and it's just commendable in terms of the efforts they are putting to help people. इतने request आते हैं कई बारी as I said रात के 2 बजे 3 बजे, and इतने सिस्टमैटिकली और प्रोफेशनली हैंडल हो रहा है कि भाई ये केस के बारे में ऐसे करना है, फॉलो अप्स हो रहे हैं. एंड जैसे हम लोगों का है वी आर ऑर्गेनाइजिंग मेडिसिन फॉर देम. सो जिसको भी चाहिए होता है वी रिक्वेस्ट देम कि रिपोर्ट भेजे हमको, सो वी सी द रिपोर्ट, और जो इनिशियल किट है वी ऑर्गेनाइज एंड सेंड दैट, ताकि जो फर्स्ट वीक है एटलीस्ट फॉर देम the monitoring period at home, it's easy for them, because once they know they have tested, obviously it's not advisable for them to go out and even to buy medicines. So there are people who are staying थोड़ी दूर जगह पे जिनके कोई हेल्प नहीं है, families नहीं है, so we have been able to send medicines to them. And yes, it has been helpful, but obviously उसके बाद जो second stage है, if it's जिनका बहुत serious हो जाता है, so the helpline जो team है, they try to find beds and try to connect them to the hospitals. Difficult hai, but they try their best. And once again, thank you to all the members of the the helpline team for helping and working closely at this pandemic time.
अभी ये बताना है कि हमने ऑक्सीजन सिलेंडर्स रखे हुए हैं जिनको भी ज़रूरत है, those who really need in a desperate, we have the cylinders, and we have a oxygen concentrator. These are also ready. Whoever wants, they can contact Nikon, Pindarji, Renuji, me, we can help you out in this one. We let you borrow that one and we can return to us and we'll help out the person who really needs. Okay, there's a good message from Aruni ji. Yes, you are also part of us, Aruni ji.
And just want to
जी
add to recently we had done with the Klongthai, जहाँ पे आप गए थे Klongthai, to reach out to the vendors in around that area. So if you can mention about the Klongthai support as well.
yeah we took certain amount because we are looking at the Indian association is not only catered to Indians only. We are living in
Right.
Thailand. We are helping out Thai people also, local, and there are lots of Burmese, Nepalis are there. They are directly or indirectly connected with us also. So we are helping all those communities also. So now in pandemic there are so many cases have come, so many suddenly they are bringing those. We can stop that problem right over there. They are not bringing the problems to us, but I rather say we have to stop the problem right away. Whatever we can, we helping them. So whenever anybody have any suggestion, they can always come back on this Facebook or to IAT page. You can give suggestion. You like to be volunteer, please come in. You like to what can I say, give a contribution? Yes, contribution anyway, monetary, with the time, with some things you want to do. Some people have medicines to give, like doctors. They come, they give the free consulting, online and offline. So I really appreciate all this thing. We can say we are together, COVID warriors. So we can together, we can live together, and we can help out each other. जी, thank you very much. I think we covered everything. Next week फिर हम मिलेंगे एक नए डॉक्टर के साथ या नए नए एक्सपर्ट के साथ on this IAT channel पे. Thank you very much. Bye bye. Take care.
Sorry, huh?
सवारी